You
The
did
show's
it.
woohoo! It's always the first time for everything. Hello, good to see you.
Good to see you too. How are you?
I'm well, thank you. Okay, well, we'll jump in. I'm here with Dr Mandeep Johal, airway, functional airway dentist, and she's looking at all things to do with human health, not just at the teeth, which we love. We're always excited to talk to those in the dental field who see the world in the bigger lens. And for those of you who haven't met me before, I'm Mary Bourke, and I'm actually a chiropractor. I'm also the CEO of Myo Munchee, but I'm always looking through the functional big picture lens too. And that's what we're always doing here at Myo Munchee. We're always trying to join the dots on the bigger issues and what's the simple things we can do to make the biggest change. And I think the more we understand, the more we can do that, the more chance we've got of solving some of these massive health issues that we've got going on. And I'm going to let Mandeep introduce a little bit more about what she's about, what her big mission is, because I love to hear about heal, which is
Oh,
her
thank
bigger
you.
piece.
Thank you so much. Yeah. Well, my whole mission, like you said, like I can't do, I'm a functional dentist, but what I do, I can't do it on my own, Mary. I need practitioners like yourself, manual therapists. We need a team approach to treat our patients. So that's why I initiated my mission, Heal, is to bring and teach other practitioners, not just what I do, but to also learn from what they do. And then all these aha moments start happening, these light bulbs start going up, and I'm like, oh yes, I could refer that patient to you and that could help them with this. Or I learned so much about vision. I'm not a vision therapist, but because I learned about peripheral vision, which I had no idea is actually what 80 to 90% revisual cortex. But when you go to the eye doctor, they're checking your 20/20 reading vision, which is great because kids need to read, we need to read. But our peripheral vision is so important for our posture. Again, I didn't know that unless I had attended the lectures or made the connection with the vision therapist specialist to learn that. So I just want to open that door up for everybody else to learn who doesn't even know that connection is possible. But there's so many more connections, which I love because that's what you're all about too, is connecting all these dots. And for those of you that are listening that doesn't know what Mary does, she is a chiro, but what's really fascinating about Mary is that her understanding and knowledge of the face, the oral structure, and the nerves. She could cite all the muscles and the nerves right away, which I love so much because I want more manual therapists in the mouth because we need to work together. You may not be able to fix the jaw, line up the teeth, but you can direct patients in that right direction, and that's how we work together.
Absolutely. No, that's fantastic. And that's what we're jamming these ideas. And we're going to talk today about some of these really simple functional movements and what they look like in your world when they don't work well. And I think that so chew, swallow, breathe is the piece that we're going to talk about today. We're going to break those three movements down, but they're the movements that are essential for growing your face and the jaws and the upper airway. So let's just, I want to hear your little bit of insight into how that works in your world, because in my world, it's very much what the munchie enables you to do. Chew, swallow, breathe. It helps train that combination of movements, which should work together. But yeah, what does it look like in your world when those functional movements don't get integrated well early on in life?
Yeah, so well, like I treat from 0 to 100. And when people think chew, swallow, breathe, I bet you a lot of people here are thinking, well, that's for babies. Or they're thinking, I'm adult, I'm breathing, and I chew my food and obviously swallow it, and I'm breathing because I'm alive. But that doesn't mean you're doing it correctly. We put so much attention into the foods we're eating or how we work out, our posture. Oh, I got to lift this weight correctly, or I might tweak something. But our body doesn't necessarily work like that or give us a lot of flashy signals when it comes to improper chewing, swallowing, or breathing. But we can see those little signals on little babies when they give us symptoms like they can't breastfeed properly. But let's break it down even further for all age groups. When it comes to chewing, kids that are not chewing properly, meaning using the muscles of the face, that means muscle dictates bone. their faces aren't going to grow to their potential. They're still going to grow, because I don't like that fear mongering either, Mary. I think it's really important that parents that are on here today, I don't want them to be worried. I want them to know there's something that we can help them with, but we're just here to help them go to their potential. So chewing is like getting those muscles to do the work to grow bone. That's how bone grows, especially during those early early on years, that are the formative years, but that's when they're growing exponentially. The swallowing is very complicated. We'll talk about swallowing later, but swallowing is, we need to get that tongue on the roof of the mouth, because that's what helps grow the face forward. Again, tongue is a muscle which is hitting or touching the bone, our maxilla. That's helping it grow wider and forward. But the key to the roof of our mouth is, you got to remember, this structure sits right on top of that palate. And that structure is our nose. We need our children breathing through the nose and getting that nose developing that nose. Because you just see, the thing is, I always tell parents this, Mary, have you ever seen a child under the age of 13 with like a hooked nose or a funny looking nose? They all have this cute little button nose. And it happens later on when you really start seeing the face stops growing, and then you get the soft tissue that just kind of drops, and you get the different formations of the nose happening. So parents don't really think too much about the nose, but from an airway dentist, from the x-rays that I look at, I can see what's already happening. If that maxilla is not growing, this part is also fixed and this is fixed, this is going to drop, or this is going to change shape. So that's the early formative years. That's what we want, proper nasal breathing. That's what we want, proper structure. And the breathing, we need nasal breathing to help develop our proper airway for our kids. And we could do a deeper dive. I don't know what direction you want to take this into, but just breathing through the nose, the benefits of it are just tenfold, especially again during those formative years.
It's what we're born to do, aren't we? As humans, we are physiologically programmed to breathe, to nasal breathe. And I think understanding that is really important for parents. That mouth breathing, that's a survival response. We're very clever. And as you said, you're not trying to alarm and scare people. We have these survival responses, and we work around things, and we adapt, and we compensate incredibly. But what we're looking for is that ideal expression of the best potential of each little child particularly, but also across the lifespan, maintaining good function. And so the chewing for the facial growth, and as you said, the tongue posture it's that forces between the air going through the nose and the tongue pressing up every time you swallow. And the swallow, as you said, is a complex thing, but we do it thousands of times a day. And so we need to, and it's not something we have to, thank God, work out how to do ourselves. It's there. We just have to try and ensure they get the opportunity. And the chewing of the hard foods is what really activates a lot of that in the babies and the children as they're growing, that ability for the tongue to start really moving around and managing all those things. So, yeah, absolutely. And that's what you're working with people coming with faces, teeth, jaws that aren't developing as they ideally should be, or even in life. Do you want to talk about any other cases or ways you see that expressed?
Yeah. So for children, you see crowded teeth, or you see the lower jaw so retruded back. And then the crowded teeth, I know people think it's not an aesthetic thing, it's a symptom. Because if you have crowded teeth, that already tells us your jaws are too small. We need to work on that as well. But then that also means your airway is too small. And now we're dealing with patients. I have children, I treat so many children that have sleep apnea, sleep disorder breathing, they're snoring at nighttime. So we're really looking at symptoms, and that's ultimately what it comes down to, is that chewing that you talked about, developing those faces nice and broad out and forward. And not so fixated on the cute little cheeks and the cute little nose, which I feel so bad as a practitioner telling the parents. I'm like, yeah, but your child's not sleeping well. But then the grandparents in the room, they're like, I don't know, my grandchild looks adorable and cute. I don't think he's tongue-tied, or I don't think he has an airway issue. And I'm like, you're right, very cute, but these are the symptoms that are there, but the child isn't hitting milestones that they should be hitting.
And so you just touched on a great word there, milestones. And that's something that I have really tried to bring to the table and create more awareness about. I think we've always been aware of movement milestones, rolling, crawling, all the different things we want to see the child do in the first year. We have these oral milestone moments too, don't we? We have moments where they should be hitting certain things that tell us that that's on the right trajectory. And that's a big passion for us here, that 0 to 2 years, what are the oral movement milestones? What are you looking to see them be able to do and achieve so that they can grow these optimally functioning faces? And that first part of it being chew, swallow, breathe. I'm sorry, suck, swallow, breathe, excuse me. The
Celebrate,
baby
yeah.
with the breastfeeding, that's the very first functional movement for facial growth. So it's getting that swallow and the tongue function wired up. And then we translate into that chew, swallow, breathe coordination. And I know you're super interested in cranial nerves, and I'm sure you have a way of communicating that in a way that's that people can understand too. Do you want to just touch on some of that?
Yeah, so the cranial nerves play a role in, let's just say, well, you touched on so many things I want to talk about for babies too, but I'll go to the cranial nerve part. But the cranial nerves play a huge role because when a baby, for instance, comes in and the mom's like, oh, they're gaining weight, it's a chunky baby, but the baby has a gag, meaning you touch the palate right here and the baby gags. They just, baby wants to throw up. That's where the cranial nerves play a role because what's happened is it depends on the type of birth they have. So I need to know the whole health history. I work with the birth history. I work with the lactation consultant, and then we know the referrals to make because what's happened is the 12 cranial nerves that we're focused on, but the ones that are really focused on for swallowing, there's impingement somewhere. And again, that's not my scope. That's your guy's scope. Is there some impingement, usually in the upper cervical in this area? We need those nerves like free flowing and no impingement, meaning the nerve goes through here, but if there's impingement, you're squeezing on the nerve. You just want it to free flow to allow that nerve to function, to allow that the tongue to lift, to get rid of that gag, to give proper communication to the brain so the baby could do what's called a proper swallow. Babies are superhumans. I tell parents all the time, they're going to find a way to survive. Humans, we are very good at that. We're good at compensation, but that baby will find a way. So that's for the baby example. But I want to give you another example when it comes to older children or adults when we're doing tongue tie releases. They also present with a gag. And what's up happening with these patients is their cranial nerves are misfiring, meaning the trigeminal nerve sometimes is overactive, or sometimes their facial muscles aren't coordinating the way they should be. The facial nerve to get the nares going and breathing through their nose. Do you know how many of my patients, when I ask them to breathe, no action happens here? That means their facial nerves aren't being activated. Or when I have them swallow, they squint. What do your eyes have to do with swallowing? That's also a miscommunication with their cranial nerve. So I would love for the myofunctional world to look into not just the chewing, swallowing, breathing, but add in the cranial nerves and really understand which nerves are involved and how do we activate them while working with the manual therapist. And you can activate them simple as like for your tongue, lemon on the tip of the tongue, vinegar, apple cider vinegar for the posterior of the tongue, get that glossopharyngeal nerve activating, warm it up. Like there's so much that we can do. Even breathing, our accessory nerve, we need to make sure that the accessory nerve can function the way it's supposed to. So our shoulders move the way they're supposed to, so our rib cage can move the way it needs to move. But these are all things sometimes I feel like get missed because we're just quick to like, let's do this treatment, let's do this treatment. But sometimes it's as quick as just having the patient do touch on the face, having them do a swallow and having them eyes go up and down, like simple little tricks that we can do. But that's where your Myo Munchee really comes into play, which I love for my patients, even babies. Like I'm sitting in my baby room where I do most of my chats. This is where we do our baby assessments in this room. So I have all my baby accessories here, but parents are always like, wait, why does my child need this? They don't realize how much stimulation they need. At 3 months, if your baby's not putting their hand in the mouth and stimulating all the way at the posterior, I'm going to help you with that. I'm going to give you something like this. It's worth it because that stimulation right at the back, it's an itch the baby has. I know they're teething here. Do you know how many teething toys are on the market, Mary, that are like this small? And parents are under the impression that because my child, the teeth are erupting here, I'm just going to give him something here. That's not how it works. You want to stimulate the jaw, which is going to help have erupt those teeth. That's how it works. That's why the power of the chewing is so important.
Yeah, that's fantastic. And I love that we're talking about that, because it's understanding that that brain is getting all its input. And like you said, there's all these phenomenally simple things we can do, because all those things you're talking about, they're waking up different parts of the brain. So those cranial nerves and all that information has more than a third of all your brain neurosensory information is for this lower third of the face, because it's got such important work to do. It's how we
Amazing.
breathe, it's how we feed, it's how we communicate. There's so much to be done. And that's why all this intricate, incredible nerve information is coming in here. And that's, I love what you're talking about there. We all need to understand, anyone that's working with um, particularly this part of the body, but anyone, being able to assess where the miscommunication between those nerves are, because that's what we find, isn't it? That the body's compensated, adapted, made ways to ensure they can get the air in, and that they can swallow the food. And a lot of the time, yeah, there's a full body swallow and things like that, because they can't access the correct messaging. So, I love what you're talking about there. And yes, and that's why I developed that little baby tool, the Myo Munchee BB, as we call it, because there's so much great opportunity to put that little device in there. And the way it's designed with all those little prongs, it's just like a barrage of information to the brain to go, yes, wake it all up, because and then activating into that chewing and getting all that tongue lateralization and that periodontal ligament, which is what's coordinating where the teeth land. I just find that so phenomenal, that the teeth, it's not random where they land, it's from the brain's coordinating all of that with the information that comes in. And so, as you say, with that whole idea of a teething toy just coming here, we want that whole, all those gums being stimulated, so that the brain's getting as much good information as it can about where to put the teeth in relationship to each
Yes.
other. And things like pacifiers, they are a nightmare. We won't even go there, but they really interfere, don't they, with how the clever, clever brain is trying to coordinate it all.
And that's the thing. Think about how much power and brain power goes into this coordination, that if something is kind of misfiring, think about when you're an adult now. If you lost a tooth or your bite's a little off or crossbite, think about that amount of misinformation the brain has, because it was never wired to have your jaw in this position. It was never wired to have missing teeth. And you may think, well, I function this long, no problem. You have, but I think people are really forgetting about compensation. And the layperson may not care, Mary. That's why sometimes when you and I talk, I always bring up athletes, because athletes are so driven on getting that extra like seconds when they're sprinting or lifting that extra weight. And patients are so shocked, like patients, like athletic patients that are like runners or weightlifters or football, soccer players, when I just help balance their bite and they're able to like lift more, and they're like, how did that work? I'm like, that's your brain. That's how powerful the bite is. So I don't want you biting on something hard all day long, but that's the power. And now think about it. All that energy that your body's constantly wasting, your brain power, all the energy is wasted on calculating, wait, where am I? Where am I? What am I doing? That body, your brain could be using that body for so many other things. So it's just really
Yeah.
hard to drive it home for the lay person. But it's like if you have a goal, then that's when people start doing a deeper dive. But I think we should be all training and thinking like, how are we going to raise our kids to be athletic anyways, right? I think we just need to
Yeah.
have that paradigm shift.
Yeah, that's right. How do we get their best performance? Because
Yes.
it comes out in all the other ways too, in the way ability. One of the most complex things to do is to sit still. And this is what you need, to really finely tune vestibular system, balance systems. Everything needs to be working really well for that child to turn up in class and sit and take the information in. And so it's kind of like they need to be at that peak performance to do it. And they're just the things that we should have. And because of so we're so sedentary now, we're not getting opportunity to really finely tuned body movements, we're now really seeing it translate very clearly to the jaws and this airway, because it's interesting. The 26 muscles, the same 26 muscles that keep your airway open at night, are the same 26 muscles that you use to swallow. So if your swallow is not working well, there's a very high chance at night the strength of that area may not be, is going to collapse a little bit when it's trying to keep that airway open. And that's something that we need to get. So, and what that looks like, so it's how do people know that their swallow's dysfunctional? It's a hard thing to kind of assess. But for children particularly, we want to see this chew, swallow, breathe when they're eating their food. We want to see their lips are together. They're able to coordinate nasal breathing with the swallow. What we're often seeing is the mouth will be open, the food will be moving around in the mouth, they'll be mouth breathing, and then the tongue will often not be doing that correct swallow, base of tongue going up, and they'll have to engage all the facial muscles and the body. And this
And the
is
neck.
what we see really, yeah, that one. And as a chiropractor of over 30 years experience, I can now see that so many of these people with forward head posture that we were treating, you know, that was a light bulb moment about 10 years ago for me to realise, oh, all those people with recurrent forward head posture issues are mouth breathing and swallowing incorrectly. So they're permanently in that posture. And so, and then that gets ingrained into the system. So it's starting to recognize some of these signs early with young children, because the earlier we intervene, the bigger impact we can have. And
Right.
training them, slowing down and realizing that every mealtime is a training opportunity, like the athletes, as you say.
It's true. Oh, did you freeze or did I freeze? Oh, I hope it's not me.
Oh,
Think you
am
might
I
have froze.
back?
Yeah. Yeah, you're
Not sure what
back.
that was. Said something.
No, you're good.
um,
It could have been a
we'll
connection.
wind it
You
up soon, just in case it comes back to say something.
no, no, it well, we could go on, but you're right. But sorry, go on. You left at the athlete part. Yeah.
What was that?
I said you left at every child opportunity, like when you're eating with them at dinner,
Yes,
anytime to
when
train
you're
them.
eating with them, because once they know how to do that, you want it under unconscious control. This is the whole thing, isn't it? It's taking it from the consciousness. You don't have to think about how to swallow every time, thank God. These
Hmm.
become part of your brain physiology. There's parts of the brain where they become automatic, cerebellum, motor planning. It happens without you thinking about it. But what you want, and that's why dysfunctional patterns are so hard to fix too, because they get wired in like that. But you've got an opportunity with young children to make sure the right information gets wired in. And that's what we really want to see, is taking the time at meal times, slow down, remind them, model it for them, adults.
It's true, but
It's
I will share as a parent of young boys. I put a timer on because it does become stressful because it is our dinner time. So I put like sometimes I started with a 2 minute timer once, but now I'm at 5 minutes where we're like it's like constant nagging. You don't want dinner to be
no,
like that either. So
yeah.
I put a 5 minute timer on, and they know I'm going to be on them, and they're like on their best behavior, like posture wise and everything. After the 5 minutes, it takes time for it to dwindle down, but they know to sit up, and they're extra judgy now when they see other kids. I'm like, well, don't mirror it, but at least they know. At least they know. That's what I say. You touched on so many things, Mary. You talked about the reason like we're doing this chew, swallow, breathing is ultimately it's also going to affect your posture because your airway isn't there. But what I wanted to bring up, you mentioned, is all those years of practice with the poor neck posture. And now parents are so worried that the kids are on their electronics, and now it's going to be compounded. And I think that's what we're missing too. And I tell parents, it's like, oh yeah, no, no, it's because they're on their electronics. I'm like, yeah, but now it's being compounded. Like they already had poor posture. They were already mouth breathing. They already had smaller jaws. Their head was already forward, and now this is making it worse. I can't even imagine how hard it is going to be for chiros and osteos when these kids are going to start feeling the pain and discomfort maybe in the earliest 30s. I have some kids that feel neck pain and back pain as early as late 20s now because they already had a lot of dysfunction. So now they feel it. But the average adult for me comes in for, because I do tongue tie releases as well, they don't start feeling symptoms until like maybe mid 30s. That's when the body can't compensate as well. But I have a feeling it's going to be a lot earlier for this generation because of the compounding effects.
Yeah, I think you're very right there, and I think this is something really important with the dental community, particularly if they're looking at, because the teeth end up being a fantastic stabilization of a good posture. They lock the whole system in, which is what we're ideally looking for. But conversely, if there is work being done on a system that is compromised, as you say, and many of them are weak and in not ideal forward head posture, to put the teeth in alignment to that body posture, that's a big problem. So we really need, for anyone listening who's looking at working with dentists, with their children, with teeth alignment, for example, make sure you're looking at those underlying muscular patterns and the body posture, because it has to be part of the longer term solution. But it's over 20 minutes now, so it's time for us to wind up. But it's been great to have you here. Thank you so
Yes,
much for joining
you're
me.
welcome. We do have some questions which we will answer at our next live, which we're doing
Oh,
again.
how do
I'm
we,
so
where do we see
excited.
questions? That's novel. I don't know how
They're
to
at
do
the
that.
bottom, but I promise we'll get to these questions later because we
Yeah.
are only doing 20-minute IGs, but this is a great way to get everybody back again to listen to us.
Because
I
we're
think
coming
this
back
next
again
week.
next week. All right,
Yeah.
perfect. Well, we'll get the questions and we'll answer them then, and I'll work out how to find them.
All right. Thank you so much, Mary, for this. So I hope this is saved. I know your team's going to save this and then we
Yes,
can repost it for
yes.
everybody that was watching. And we did explain airway and posture too, but thank you again for doing this. And I love, love what you are doing. Thank you so much for spreading all your awareness and knowledge to the world.
Great to have you here, and I look forward to picking the conversation up again next week, and we'll see where the direction is from some of the questions. Okay.
All right. Take
Great to
care.
see you,
Bye.
Mandeep. Bye-bye.